When a client experiences immobility, normally healthy alveoli can collapse and cause decreased lung function. Decreased lung function can reduce a person's stamina and their ability to perform activities, referred to as activity intolerance. To prevent a decrease in lung function, reduce the buildup of fluids in the airways, and prevent pneumonia, clients are often prescribed incentive spirometry to keep their bronchioles open. The incentive spirometer encourages a client to complete slow, deep breathing to keep their bronchioles open. See the image of a client using an incentive spirometer. Nursing assistants are often expected to encourage clients to use their incentive spirometer hourly. The nurse or respiratory therapist initially teaches the client how to use the incentive spirometer, but encouraging and observing clients complete this action every hour is commonly delegated to a nursing assistant. The client should sit upright if possible, place the mouthpiece in their mouth, and create a tight seal with their lips around it. They should breathe in slowly and as deeply as possible through the tubing, with the goal of raising the piston to their prescribed level. The resistance indicator on the right side should be monitored to ensure they are not breathing in too quickly. The client should attempt to hold their breath for as long as possible, at least 5 seconds, and then exhale and rest for a few seconds. Coughing is expected, and clients should be encouraged to expel any mucus, not swallow it. This technique should be repeated by the client 10 times every hour while they are awake. Report completion of the activity to the nurse, who documents frequency and effectiveness of this intervention. Deep vein thrombosis, DVT, is a common complication for clients experiencing immobility. When blood is not moving much due to client inactivity, it can coagulate, i.e., form a clot. This blockage reduces blood flow to the affected area. A deep vein thrombosis, DVT, is a blood clot that forms within the deep veins, usually of the lower leg, but can occur anywhere within the cardiovascular system. If the clot breaks free, it can travel to the lungs and become fatal. The best way for nursing assistants to prevent DVT is to assist clients to ambulate, or otherwise complete as much activity as they can tolerate. Some clients are prescribed compression stockings, also referred to as thromboembolic deterrent hose, TED hose. Compression stockings promote the return of fluid back into circulation by gently providing pressure on veins. They are commonly used for clients with swelling of their extremities, edema caused by cardiac conditions that cause fluid retention. Compression stockings require a physician's order and should be applied in the morning and taken off at night. They should be applied upon awakening because edema is usually at its lowest point after lying in bed overnight. However, as the client sits or stands upright during the day, blood tends to pool in the lower legs. The pressure from compression stockings helps return fluid into the cardiovascular system and may reduce the risk for DVT. When removed at night, the compression stockings should be washed by hand in the sink with soap and water and then hung to air dry. Do not send them to the laundry or put them on a heater to dry, because this can cause shrinking and ruin the hose. Clients often have 2 or more pairs of compression stockings to ensure they dry completely before wearing them again in the morning. Compression stockings may be knee length or hip length. The amount of pressure the hose applies to the legs is prescribed. For example, some compression stockings may seem like slightly tight socks, whereas other stockings for clients with severe edema are custom-made to fit very tightly and may have a zipper for ease of application. See the image comparing both lengths. When applying stockings, proper placement on the heel is important. The stockings have a square marker around the heel to guide correct placement on the heel. It can be difficult to see this square, but stretching the fabric around the heel area should make it more visible. See the image of locating the heel marker. If there is writing on the stocking, it should be on the outside and facing away from the skin when worn. When applying TED hose, find the heel marker first. You can gather or roll the sides of the hose down to the heel, or choose to turn the stocking inside out to the heel marker. If turned inside out, put your hand inside the hose, hold at the top of the heel marker with your thumb and forefinger, and then pull the top of the stocking down to the heel marker. See the image on the right for a demonstration of these techniques. Use any of these techniques to place the stocking on the heel, and then check for proper placement of the heel marker before applying the rest of the stocking. See the image on the right for heel placement. After the heel of the stocking is placed properly on the client's heel, check that the hose is not twisted. Make any adjustments before proceeding, because the hose will be very difficult to adjust after it is pulled up the leg. When you have the hose positioned correctly, pull the remainder of the stocking up to the knee or hip, depending upon the length of the hose. Check that there are no wrinkles in the hose and that the client has no discomfort. The toe of the stocking is typically open to allow for easy assessment of the client's circulation. The fabric should be completely over the toes, or completely at the base of the toes, to prevent skin breakdown or blockage of circulation to the toes. See the images of both types of applications of the toe opening of the stocking. Regular socks or slippers can be placed over the TEDs for warmth if desired. For specific steps in applying TED hose, see the application of compression stockings, TED hose, skills checklist at the end of the module,